Hello, my name is Amanda Conover, and I'm going to present today about the Newark Doula Network, an emerging public health initiative in Newark. So let's talk about who we are. We're a service that's going to connect underprivileged, high-risk mothers with doulas and their services. Our ultimate goal is to reduce the Black infant and Black maternal mortality rates in New Jersey, and specifically in the Newark and Northern New Jersey area. So, a doula is someone who provides non medical support nearing the end of a pregnancy, throughout the delivery. Some of them also provide antepartum and postpartum support. We're going to talk a little bit later about what we plan to do and Deanne plans to do, but let's first talk about what the problem is. So, the problem in New Jersey, Black infant mortality is very high. We're seeing 10.3 Black infants dying out of every 1,000 live births. So, that's a very high number, and we'll talk a little bit later about what that number should be. Black maternal mortality, 2009 to 2013, 78 maternal deaths that were determined to be pregnancy related. Were 46.2% of those were of non-Hispanic Black women. And the bulk of these women who died were also not in an age group that was considered to be particularly at risk or unhealthy. 55% of them, more than half, were 24 to 34 years old, so young. What's the goal? What do we want? Healthy People 2020 is no more than 6 deaths for every 1,000 births. So remember that 10.3 before, that's much higher than 6 out of every 1,000. This is already achieved for most other ethnic groups, especially in New Jersey. In Newark specifically, white infant mortality is 4.6 for every 1,000 live births. It's a little bit higher than New Jersey in general, which is 3.2. Asian Pacific Islander is 3.6 and Hispanics 4.4. So even the Asian, Hispanic, and Pacific Islander, those numbers are much closer to white infant mortality rates than they are to the Black infant mortality rates. So it doesn't seem to be just because they're not white. There's something specifically about the Black infant, something's going on. So let's take a look at Newark specifically. So the total infant mortality rate in Newark is a little high. So 8.2 for every 1,000, that's pretty high. It is also an area where there's a higher percentage of Black individuals. 47% of the live births in Newark were Black infant births. So sometimes in those areas where they're serving Black populations, there tends to be poorer care compared to white serving hospitals. So what seems to work in terms of preventing this? Let's talk about what we can do to help it. Continuous support, which is basically the doula being there from the start of the labor to the end of the labor. So By My Side program, that was a program in Brooklyn, found the continuous support model reduced risk of low birth weight and prenatal births. Mothers were also more likely to attend prenatal checkups first trimester if they had a doula, which could have been a big reason why they avoided complications. They were able to see a doctor if there is any problems. They're able to deal with them as opposed to moms who don't attend or don't have adequate prenatal care. The YWCA Greensboro doula program, doula participants were 4 times less likely to give birth to low birth weight infants and less likely to experience complications. So this could be useful for not only infant mortality, but maternal mortality if they're less likely to experience complications. So low birth weight and prenatal births are a big part of causes for infant mortality, specifically Black infant mortality. So reduction of these things could directly contribute to reducing the Black infant mortality rate. So what's our plan? We kind of are borrowing from the By My Side Brooklyn program because what they did seemed to be very beneficial, and we kind of want to build on that. They did 3 prenatal visits, continuous support during delivery, and 2 postpartum visits. For our prenatal visits, we want to see if we can start with a small group, get our doulas to attend prenatal doctor's visits if mom feels like she might need a little more support, a little more advocacy, a little more empowerment during those times. Make sure the doctor's listening to her and understanding her concerns. We also want them to be able to be contacted over phone or text, so that way they can provide support when it's needed. And then 2 postpartum visits, we want to do more if possible, if mom has very little support, because not everyone's going to have a partner at home. No, everyone's going to have family at home to help her take care of the baby. And then, of course, continuous support during delivery. So someone being there, providing comfort, providing encouragement, keeping mom aware of what's going on. If she's during delivery, she might not be aware of what's going on. So checking in with mom saying, hey, the doctor's got forceps in his hands, the doctor's got scissors in his hands. Do you want me to ask him why? So make her aware of what's happening around her. So what's the result of these doula interventions? So the research we did indicates mothers with doulas are less likely to have C-section births, less likely to give birth to low birth weight babies, and less likely to have premature babies. And like I said, the low birth weight and premature babies, that's a big reason for infant mortality. So that's really important. So our partners, let's start with WIC. WIC provides nutritious foods, nutrition counseling, breastfeeding education, breastfeeding support to women and their children. We can act as a mutual referral source. So if a doula determines a mom to be a little food insecure, we can refer her to WIC. If WIC finds that a mom has a history of preeclampsia, a history of premature delivery, or history of losing a baby, they can refer to us, and we can see if maybe our doula care will help. We also want to provide outreach and education at each other's locations, teach the clients about our programs. Maternal Child Health Partnership, they have several programs to help mothers and their children. So they have a central intake, and then they use that data from central intake to refer to their other programs. Nurse home visitation, immunization services, fetal infant mortality review, community health workers. So this is something where we can share data with one another, provide data to them. They can provide data to us, and kind of work together with our services to be able to support these women because we're looking at a similar population. And similar for Nurture New Jersey. Nurture New Jersey also is looking at doula care. Their advocacy prompted Governor Phil Murphy to sign a bill that provides Medicaid coverage for doula care. So that's something we'd love to see how that goes. We'd love to be part of that, see if we can work with Medicaid moms. They also provide medication to prevent premature birth to mothers who need it. So we might be able to refer cases that need a little more care, a little more medical attention to Nurture NJ. We also want to advocate for one another, seek resources with one another, could be a great source of like grants and funding. And the Newark Beth Israel Hospital, we want to just educate health professionals on what we do and why doula care can be helpful. All right, and outreach, we're looking at Facebook because we can target based on previous purchases, interests, relationship status, other activities. So if mom's looking for strollers, looking for diapers, searching on the internet for pregnancy-related things, our ad might be more likely to show up for them. We find that lower income teens were more likely to use Facebook compared to higher income counterparts. That's Pew Research data. And over 70% of individuals who make less than $30,000 per year have a smartphone. So they're on the internet. They're using Facebook. This is something that they can show up on their feed that they see, that it prompts them to look into us. And then we have a recruitment survey. We'll have our Facebook link to this. It gives us information about household income, family partner support, pregnancy status, history of risk factors, those risk factors that we're seeing in that research, seeing which moms are matching up with that data to find an appropriate population, and also determine what exactly is happening in our population. Is it high blood pressure, preeclampsia? Is it embolism? Is it premature birth? What's happening? Okay, so that is about it for me. So thank you for listening. I'm just going to go through the references real quick. And thank you for that. If anyone has any questions, feel free to ask. Otherwise, thank you for listening to the Doula Network, Newark Doula Network presentation. Have a good day.